Hi everyone, Lindsay Havoc. I'm here to talk to you about nurses in long-term care and their perception and understanding of sepsis, as well as their confidence in identifying sepsis. So, of course, our primary research questions: what is the nurse's understanding and perception of sepsis working in long-term care, as well as what is their confidence in that identification? So, in this research, the population mean consisted of 20 nurses, and the actual sample size consisted of 13, so pretty small. Um, the data collection process of this research consisted of nurses in this research were distributed a sepsis questionnaire, as well as listing their confidence level in sepsis identification. And this was distributed from their supervisor. There were two separate boxes. These nurses also had the chance to participate in a raffle to win a $20 Visa gift card. So, one box, they put their questionnaire after it was filled out, and the other box was where they could submit their name, phone number to participate in this raffle. They did not have to fill out a questionnaire in order to participate in this raffle. Anybody could. That was a nurse. Um, After that data collection process, the data demonstrated that increased sepsis knowledge was identified in LPNs. It was identified with acute care experience and long-term care experience. And the greatest significance was demonstrated between registered nurses and that sepsis knowledge. So if we actually look at our results here, we're looking at just experience. 92% of participants had 10 or more years of experience in acute care, in that acute care setting. Registered nurses demonstrated the most sepsis knowledge and confidence. Nurses with acute care and long-term care experience also demonstrated more confidence. And LPNs, with the way that the sepsis questionnaires were completed, the LPNs that had acute care experience, it was demonstrated that those LPNs that had the acute care experience had probably moved on to working in long-term care. So that was kind of a key finding with these LPNs that often go to long-term care. They had that previous acute care experience where they might have seen more sepsis. So with those significant correlations demonstrated, there was actually a lot of confidence in sepsis identification, which I was really impressed with. And then if we're looking at our theory here by Gene Watson, of course, the education level, whether these were RNs or LPNs, that will make a difference in the knowledge base just on your experience in long-term care as well, and then the experience with acute care. And then, of course, I wanted to plug in a little how sepsis can affect the patient in long-term care. Many of our organ systems are affected, and this is not anything to take lightly. So, really impressed with the results overall. These nurses really demonstrated knowledge and confidence in their sepsis identification. Thank you.